Hello, thanks for stopping by. Welcome to this 2021 Medicare Advantage Clarity presentation. Clear answers to your Medicare questions. This is me. I'm Tom Basie. I'll leave my phone number and my email address there. Please feel free to reach out to me. After this, if you have further questions, I'd love to help you. I'd like to discuss it. As I remark here, I'm licensed in not only Texas, but Oklahoma and Florida, Georgia, California, Arizona, and Washington. Aparte, yo hablo español, yo puedo entender a la gente en su idioma, se sienten más a gusto hablando español. So please feel free to reach out to me at the end of this presentation and let me know if I can be of further assistance to you. So here's the thing. This is what we will talk about today. I will discuss briefly Medicare choices, including eligibility enrollment for Medicare. I will discuss the advantages of Medicare Advantage. I will remark briefly on Medicare supplement and drug plans as well. I will spend some time on prescription drug coverage. That's a point of confusion for many people, so I hope to provide some clarity there. I will show you some specific Medicare Advantage plan information, lay 4 of them side by side and talk through the differences to give you a feel for how they work and how they differ. Remark about how I or any other agent can be of assistance to you, tell you about some additional resources that can be made available to you, and then finally, I will remark on why you might considering United Healthcare as your partner on your Medicare journey. So here's the thing at the highest level, Medicare is a red, white, and blue card. It comes from the federal government. It's got your name on it, a Medicare ID. It has numbers and letters in it. And then hospitalization Part A and Part B is non-hospitalization. The effectivity dates on both those. When they start, potentially Part A, which is hospital, could start at one date, and potentially Part B, which is non-hospital, going to the doctor, going to labs, outpatient surgeries, anything that's not in the hospital. Those are 2 separate pieces of Medicare. You get them both from the federal government. In 2021, there's a deductible of $1,484 for Part A, the hospitalization, and there's a deductible for $203 for Part B. Typically, Part A is already paid for. Typically, when you sign up for Medicare Part B, you will have to pay for it at that time going forward. And for most people, that costs $148.50. So that's Medicare at a high level. You can get it from the government. Now, having said that, there are a couple of things that make it some lacking. For one, there's no medication coverage in there. So you need to do something about that. And then number 2, there's no out-of-pocket maximum. So potentially, if you just had this red, white, and blue card and that's all you use, not only does it not pay for medication, but if you kept going to the hospital or doctor and stuff, the bills could continue to kind of add up. So I endorse getting a plan or something that will kind of cap that. So here's the thing. You got 2 options, really. Option 1, you could get a Medicare supplement insurance. Now that also, Medicare supplements don't have drug coverage, so they need want to add a drug plan. So certainly that's one way to go. You can get a Medicare supplement policy and you can add a drug plan to it. The thing is, those are nice and thorough plans. Typically, they will cost significantly per month, and then they'll be relatively low cost of care. That's good, but they don't have things. For example, there's not dental and vision, hearing, some other things that are covered there. But there's certainly one option to consider. What I'm going to spend most of my time about at this point talking about is an Advantage plan. It does have drug coverage included. It has some additional benefits, and we'll talk about those, potentially vision or hearing or dental coverage that come in an Advantage plan. Advantage plans differ, and they typically cost much less. Now, there will be more copay, so I'll kind of share that with you and give you an example of how that's going to cost. So option 1 versus option 2, those are 2 things you consider: Medicare supplement drug plan or the Advantage plan. Now, having said that, let's talk about either way. You need to have Medicare. You got to be 65 years old. Typically, you can get under 65. You can qualify, for example, on disability. After 24 months of permanent disability, typically you can get Medicare. And then typically it's for U.S. citizens. Well, you can be a resident if you've been here legally 5 years living in the U.S. consecutive as well. But as a general rule, it's for 65-year-old U.S. residents, not exclusively them though. There's an initial enrollment period. It's a 7-month window. The month when you turn 65, 3 months after that or 3 months before that's the initial enrollment period, and it's time when you can sign up and get an Advantage plan or a drug plan, for example. That's the time to do that. I'll mention this one and I'll say it again. If you don't get some kind of drug coverage, one way or the other, when you get Medicare, there's a penalty associated with waiting and getting it later. So I recommend going ahead and getting some kind of coverage when you get Medicare. We'll talk more about that. Okay, in addition, let's say you're already enrolled in Medicare and an Advantage plan. Well, there's a couple of things you ought to be aware of. For one thing, October 15th to December 7th is annual enrollment period. You can add or drop or switch Medicare coverage and Medicare Advantage plans there at that time. There's also the first quarter of the year after that, from January 1 to March 31. You can make a one-time change, for example, if you need to there. So there are a couple of standard windows every year that open. If you need to make a change to a Medicare Advantage plan or a drug plan, you can do it at that time. Having said that, other times during the year, well, if you retire and then you don't have employer coverage, or if you move, if you're on an Advantage plan, which are typically area and plan based. If you move out of the area, then that's another time when there's something called a special enrollment period. So you can get a special enrollment period if you're retired, if you move, if you qualify for extra help. That is, if you hit financial hard times and qualify for financial assistance from the government, that's another special enrollment period. And then finally, if you get a diagnosis of certain chronic health conditions, maybe diabetes, maybe heart disease might be, chronic heart disease might be example of those. But any of those 4 events occur in addition to previous periods. There's a special enrollment period if that occurs, where you can then address your health needs and your plan needs. Now, here's a couple of things. It says the advantage of Medicare Advantage. I think of it more as compelling statistics. Number one, over 24 million people have enrolled in Medicare Advantage plans as of 2020. Of those, 93% of them report satisfaction. More than 9 out of 10 are satisfied with them. So a lot of people have them, and a lot of people are satisfied with those plans. And the reason is because typically they spend 25% or less than if you just have Medicare alone. So it's cost savings. So 3 compelling statistics, I think, why you should consider an Advantage plan. Now this is a nice, compelling or explanation. Original Medicare versus Advantage plans. The first 3, hospital stays, translation Part A, coverage for some medical care like doctor visits and flu shots. This is Part B. Original Medicare has that, as does an Advantage plan. Now, the rest of these, no coverage. Original Medicare doesn't have prescription drug coverage, routine vision, routine hearing, and limit on your out-of-pocket max. It's a no coverage. These are all checks for Advantage plan. This doesn't say dental. Some plans have dental. Little asterisk here because it varies plan by plan, but typically you can get this other stuff. Maybe you want to call them bells and whistles in addition to Part A and Part B through an Advantage plan that you don't get on original Medicare. Having said that, I'm going to step through briefly the top 10 here. It's not necessarily in order, but these are important enough that I need to mention. You must continue to pay your Part B premium. The thing is, you can sign up for a Medicare Advantage plan. Maybe you'll get a plan that costs $0 per month. That's fine, but you still need to pay your Part B premium. So it's a $0 premium on the Advantage plan, but you got to pay your Part B premium. Medicare Advantage has you covered. It covers like original Medicare. Joining a Medicare Advantage plan may affect your current coverage. I remarked both about the special enrollment period. If you lost a job, for example, it can be an impact there. Or potentially, if you have some kind of coverage, like if you're a veteran, there's certain Advantage plans designed to help. They play nicely with existing veterans benefits. It says it's best to use network providers. Really almost never use that word best, but I'll use it here because these plans are designed, things cost less if you do that. So some plans allow you to go out of network, be it for the pharmacy or care, but it will cost less to do in network. So that's why we can say it's best to use network providers. You may qualify for financial assistance, and there are some plans, not only may someone qualify for financial assistance, there are special plans that are typically feature rich for someone who does qualify for financial assistance. So it's something to be aware of when you consider an Advantage plan. 5 more here. I said this once, but I want to say it again. If you enroll in Part D, think of D as in drug. If you enroll in Part D late, you may pay a penalty. So if you get Medicare, whether you consider option 1 or option 2, if you're late on that, if you wait a year or 2 before you do that, there's a penalty associated with it. And so I'm a proponent of taking care of the Part D drug coverage one way or the other, an Advantage plan, a drug plan, something, but don't wait. Avoid that penalty. A Medicare supplement insurance plan, sometimes called a Medigap policy, is not a Medicare Advantage plan. Just making that distinction, that's at option 1 versus option 2. Medicare supplement costs more, but has less out-of-pocket cost. It doesn't have drug coverage included, and it doesn't have the bells and whistles. So it's a high-level difference. Keep your member ID card handy. If you sign up for a Medicare Advantage plan, you can leave your Medicard safely at home, your Medicare card, and if you go to your primary care physician, show them your Advantage plan. If your plan has dental and you go to the dental, you go to the dentist. If you're getting some vision checked and your plan has vision coverage, you show that. You go to the pharmacy. So you use your Advantage plan everywhere, and you can leave your Medicare card at home once you sign up for an Advantage plan. Medicare Advantage plan offers the same protections as original Medicare. That's the first 3 checks on the side-by-side column. It offers that and then some. And that last one's a compelling, important one. You have a built-in financial safety net. So that's the thing. Medicare by itself, in theory, you could keep going and having care and there would be no end to it. It varies plan per plan, but typically I'm going to use the number $4,000. If you get a plan that has $4,000, then no matter how big and expensive your care is during the year, once you hit that out-of-pocket max, you don't have to pay for more. The plan pays the rest of the hospital bills and the doctor bills. So that's a very compelling and important point to make. Okay. I'm going to spend a little time on prescription drug coverage because it is a point of confusion for people. So here's 4 payment stages: the deductible stage, and then initial, coverage gap, catastrophic phase. I want to explain those to you because one of the questions I get more often than anything else is, hey, I've got the same medication or list of medications. I'm going to the same pharmacies. Why does it cost different amounts during the year? Well, the reason is because of these different phases. Now, if you have low cost medications, you may not, once you pass the deductible stage, you may just stay in initial coverage the whole time, so it won't change. But if you have expensive medications, this explains how and implement it. So number one, the annual deductible phase, that's the thing. Some plans may have, let's say, a $300 deductible. Implication is you got to pay $300 before the plan kicks in and starts paying for your medication. So some plans have $0 deductibles, whatever it is, that's certainly one phase. Once you've met the deductible, you're in initial coverage phase. And typically there's a copay. So the cost of the medication is one thing, but you as the insured only pay a copay of it. And so what I would offer is I'll just make up an example for these next three phases. I'm going to say that the retail cost of expensive drug or drugs that you have is $1,000. And I'm going to make up and say that the copays turn out to be on those actually only $100. So, and let's say there's no deductible phase. So your first 4 months, you're going to pay $100, $100, $100, $100 each month. And that's because that's your copay. Notice that's the member pays versus the plan pays. The plan pays for the rest of that, the $900. Once your drug costs exceed $41.30, so into month 5, your drug costs that exceeded that, you're in the coverage gap now. So once you're in the coverage gaps for the following months, instead of paying that $100 copay, you now pay 25% of your drug costs. That's why I picked the example of $1,000 because it's easy for me to calculate. That's $250. So now in months 6 and 7 and 8, well, 6 and 7. You are 5, 6, and 7 potentially, as long as once your drugs cost that exceeded that, you're paying 25%. Actually, once it exceeds $65.50, maybe by month 7, you're back on the backside of this. But in 3 months, you're paying $250 a month. Once you're into month 7, or after you've paid $65.50 for months 8, 9, 10, 11, and 12, the rest of those, you're back in the catastrophic phase. And so now you're either going to pay a low copay or 5%, whichever is greater. On that $1,000 bill, I'm going to assume that's greater, so it's $50. So for my example here, you either paid $100 a few months, then for a couple months you paid $250, and then for the remainder of the year you paid $50 because you were in because the cost of your medication was the same. It's $1,000 a month, but what you pay, your copay was different. So that's why it varies, even though you're on the same pharmacy, you have the same list of drugs. Okay, a couple things to reiterate. Total drug cost. In my example, that was $1,000. You were paying $100 a month initially, and the plan was paying $900. That's the total cost. Doesn't include your premium. Some drug plans have a premium, so that doesn't count in there. Out-of-pocket cost is what you do pay, and so that also doesn't include the premium, but that's what you're paying. So in those examples, that was $100 a month. Any deductible that you had to pay if there was one, that $100 a month, the $250 a month, and the $50 a month, that's your out-of-pocket cost. Remember, the total drug costs are the ones that are used to determine where you are, which phase you're in. And extra help, just a little note, if you do have extra help from the federal government, potentially it'll help you. There are ways to save money on your medications that through that help as well. Pharmacy network, I remarked it's always, you can save money in pharmacy network. So there's 65,000 pharmacies in United Healthcare's network. So that means there's one near you likely. Are there? You can save prescriptions if you go to the in-network retailers. You can actually save if you do it by mail order as well. So 2 different ways to save. Go to one of the in-network retailers and or do it via mail, direct mail. The drug list is called the formulary. When you hear that word, it's just a list of drugs. Not every drug in the world is covered by a plan. So you get that plan, there's a list of formulary. Every drug on there is tiered. It's in tier 1 through tier 5. Tier 1 is preferred generic drugs. Tier 2 is generic drugs. Tier 3 is brand name drugs. Tier 4 is non-preferred drugs, and tier 5 is specialty drugs. As you might imagine, the price and the copay goes up as the tier number goes up. So that's what I mean by that. The reason I mentioned that, well, let me say a couple more definitions here. We're almost done with the drugs, but I want to make sure you understand this. Step therapy is when you try a lower cost medication, and if that doesn't work, then you can step and go to the higher one as need be. Quantity limits, as the name implies, maybe there's a certain size or amount per month, for example, that will be allowed to someone can get, and there are limits on that. And then prior authorization. Sometimes a pharmacy will not fill a prescription without a doctor authorizing it. So those are just kind of controls in place. And the thing is, you can get exceptions. So you can ask for an exception that's not on a plan. If you do, that's called a pharmacy exception. If you ask some of those restrictions, for example, that's a utilization exception. In either instance, you can request those. If the doctor submits it on your behalf, generally the decision will be made in 72 hours. It can be expedited or fast tracked if the doctor says, hey, this is critical patient health. Okay, so that's all I'm going to share with you on prescription drug plans. Now I'm going to talk for a little bit about, I'm going to take 4 plans and lay them side by side. These 4 plans happen to be ones that are available in the North Texas, Dallas, Fort Worth area. But wherever you live in the country, it's likely there are similar plans. May not have the exact same numbers, maybe not all 4 of these plans there, but these are going to be nice representation of some plans that are offered near you. And I would encourage you to think about, if you were choosing today, which one of these you would take. You're really not going to choose it today, perhaps, but at least I would encourage you to go through the exercise to just look and see how these plans differentiate. I'm going to explain to you the difference between them and think about, I like that. I don't like that. That's important to me. Think about, see if you can decide which one of those 4 plans you would choose after you see the 4 screens that I show you on this. So here we go. Okay, I've got 3 plans here that are HMO POS and 1 PPO plan. The first 2 plans have been around in the market for some time. The second 2 plans are newer plans. When I remark HMO POS, what I will say is HMO means you can only go for care in network. Now that POS makes a slight variation. It's actually, you have the option to go out of network on these plans for the dental component. This is the POS there. So with straight HMO, you simply have to go in network for care. Otherwise, it's on you have to pay for it out of pocket. With this POS component, you actually have the option to go for dental out of network, but it will have a higher copay. The PPO is actually, you do have in-network and out-network options. They're just higher copays on out-of-network, but you can do that. So this plan, it's called Choice. It has that. So this is Plan 1 and Plan 2 are the plans that have been around for a while. The one just called Medicare Advantage plan is actually kind of a reboot of Plan 1. They're quite similar. There's some differences, but Plan 1 and the Advantage plans are the most similar plans here. Plan 2 is the only one that has a premium of more than $0. The other 3 plans actually cost $0 per month. What happens on Plan 2 is you're paying a monthly premium, and what you'll do is you'll drive down your copays or you'll drive up the benefits. So I'm going to step through and show you how these vary. So here we go. I already talked about the only variation in the first line here is one of them has a premium of $73 a month. The other 3 are $0. Annual medical deductible is $0 on all 4 of these plans. The primary care visit is $0 copays on all 4 of these plans. No difference so far. Here's the first one. It's not a big deal. Specialist visit. If you go to specialist visit, the one where you're paying the copay actually has the lowest one, the $20 copay. And then the one where you have the flexibility to go in and out of network, it actually has $35. It has a higher copay. So although those are small, that kind of shows you how that works. Preventative services are all $0 copay on all 4 of these plans. So the first half of this slide seems like the only difference is the significance is the premium. Well, now here we go. Inpatient hospital stay. If you have Plan 2 where you're paying that premium, it's just $150 copay per admit when you go to the hospital. That's it. Where conversely, on Plan 1, it actually will cost you $275 a day for the first 5 days. After that, it'll drop to 0, but the first 5 days, there's a copay daily of $275. So it costs a lot less to go to the hospital on Plan 2 to pay premium than it is on Plan 1. These 2 newer plans, actually, it costs even more per day and 1 extra day. It actually is $325 a day per copay, per day copay, and it actually goes through day 6. So those are of the 4 plans, these 2 have the most expensive hospital stays. I hope you're not going to the hospital this year, but if you do, it's important to know how much it's going to cost. So that's the copay right there. Skilled nursing facility, interestingly, they all have a $0 copay for the first 20 days. And then actually after day 20, the copay value is the same. It's $184, but the number of days you have to pay that before it drops to 0 varies. So I'll start with Plan 2 because it's a paid copay. Through day 38, it's $184 a day. Then it drops to 0. For Plan 1 and its new twin brother, just the Advantage plan, both those actually go to day 42. So you have to pay a few more days if you're on either one of those plans. Again, that's because you're paying the premium. And if you have the plan, the one where you have the PPO, the option to go out of network all the time, well, that one you have to go all the way to day 57, still paying that $184 copay. So those 2 lines right there show you a significant difference in the cost of care if you were to need either of those. Don't know if you're going to need either one of those these years, but at least you know the difference in those. So there'll be something to consider. For example, if you were concerned about or anticipating something like that, might have heavily impact your decision on which of these 4 plans you'd take. Outpatient surgery, it's just a one-time copay, and it reflects the same numbers that I talked about for the daily copay on the hospital. It's only $150 for the Plan 2. Max, it's a max of $275 for Plan 1, and it's $325 for the 2 newer plans. All 4 of these plans rather, have a $0 copay on diabetes monitoring supplies and a $0 copay on home health care. So both those, so that's the thing. You can already see a significant difference on the cost of hospital stay between, but that's the main thing to take away. And then the associated skilled nursing afterwards if you needed that. So look at some other differences between these plans. This is diagnostic and radiology. The older plans are max 125 copay, max of 150. It's not a big deal, but there's a slight higher cost on the newer plans. Diagnostic test procedures is either 20 or 25. Again, that's not that big a deal. Lab services are $0 copay on all four of these plans. Outpatient x-rays are $0 copay on all three of the HMO plans. There's a $15 copay on the PPO. I think you're getting a feel for the way this works. It just simply costs a little bit more for care if you're going to have the flexibility going out of network. Ambulance is the same, ground or air. It's only $250 copay. It's pretty good pay for ambulance either way. Emergency care is the same, $90 copay, and it gets waived if you stay in the hospital. Urgent care is $40 copay on these three plans. Actually, it's only $30 if it's a contracted one for that one. So that's one kind of advantage of this plan has other ones. And now the biggest single financial number on these four plans is the out-of-pocket maximum. Plan 2, if you recall, is the paid copay. It's only $3,200 annual out-of-pocket max, no matter how big or terrible your medical bills are here. You've got an out-of-pocket max capping it, keeping you financially safe for Plan 2. For Plan 1 and its twin brother, it's actually a little bit higher. It's $3,900. So $700 difference between those plans. And then for the PPO, where you have the flexibility to go out of network, actually out-of-pocket max is $6,700. So that's the second big number. So I've shown you two big numbers, the out-of-pocket max and the stay of hospital and skilled nursing, perhaps, that are difference amongst these plans, and you've seen some different features between them. There's a little bit more for you. I'm not going to read this whole thing, but basically I'll look at the top for tier 1 drugs, $0 copay for 30-day supply here. It's actually a $3 copay for the PPO, the flexibility of going out of network. And then the annual deductible, this has $0 deductible for all three tiers, all three of the HMO plans. When you go to the PPO plan, it's a $0 deductible for only tier 1 and 2. For tiers 3, 4, and 5, and that's the more expensive drug, is actually a $45 deductible. Okay, last slide, I think, comparing these slides. Dental coverage, the one where you're paying for the premium has $1,000 of covered dental. Plan 1 only has $500. Plan 1's twin brother, if you recall, actually has more dental. So that's the thing. The difference between these is this has more dental. It actually doesn't have hearing aid, though. So dental versus hearing aid, if you're looking at these two plans, you consider that. And if you recall, this has a higher cost of hospitalization, but it doesn't have hearing. So if you want hearing, go and you want lower hospital stays, maybe Plan 1, you'll like that one, you'll like the Advantage plan. But to finish up, two plans have $1,000. The choice plan, where you can go out of network, only has $500 of dental coverage, like Plan 1. Routine vision care, all four of these plans have a $0 copay for an eye exam every 2 years. But three of these plans, the ones where you don't pay any premium, you get $100 allowance towards eyewear. You actually get $200 allowance towards eyewear on the one where you're paying the premium. So you up your benefits by paying that monthly premium on that. As I mentioned, hearing aid coverage, two of these plans, the two older plans, do have hearing aid coverage in there, and you can have a copay for as small as $175 for a couple of hearing aids. So that's a good buy. Then I assure you, there's a spectrum. You can have higher in and have a higher copay, but they have hearing benefits on those two plans. The newer plans actually don't include hearing aid coverage. Insulin program is the same on all four of these. You get a month's supply of insulin for $35 or less. Over-the-counter credit, perhaps slightly intuitively, only the one that where you're paying the premium doesn't have an over-the-counter credit. The other ones, you do have an over-the-counter credit. It says $160 per year. It's really $40 a quarter, where you can use that and you can order online or via phone. You can order over-the-counter solutions. Not talking about your prescription drug, but aspirin or antidigestive, maybe even Band-Aids, stuff you might get at a pharmacy, that it's available to you at a $40 credit per quarter. So that's a nice feature of these plans. And then gym membership. All four of these plans have something called Renew Active from United Healthcare, and basically that often results into you can get into one or more gyms near you. Not every gym will take it, but many of them all across the country take these. It's kind of like a $0 gym membership. Okay, so I'm not going to belabor this slide a lot. This is kind of showing the exact plan numbers and the counties they're offered in North Texas area. It's really not pertinent. The thing that to me to take away is think about those four plans. What did you like and didn't like about one of those plans? There's a plan near you that is similar. It may not have the exact number, but it functions like that. So think about that, and an agent can help you find one of those. Now, having said that, I remarked why I would encourage you to consider United Healthcare on your healthcare journey, your Medicare journey rather. They've got over 40 years experience in helping people in the Medicare community. Not all carriers can say that. More people choose United Healthcare for their Medicare plans than any other insurance provider. Members like and keep their Advantage plans. That 93 number that I was showing you earlier, they have a high retention and high satisfaction rates. And you have our promise and commitment to helping you live a healthier life. That's the thing. They're dedicated to that. They call you, they check on you. They have people working in stores that you can go and ask questions on them too. I'm going to volunteer and do some of that here in the next month, actually this month. So come by and see me sometime. Having said that, these are some additional resources that can be made available to you. Medicare Made Clear is it's a hard copy, and it's not unlike this presentation. Actually, kind of shows you the difference between Medicare Supplement and Advantage plans. Medicare Helpline, you can dial 1-800-Medicare and talk to somebody at CMS, the Centers for Medicare Services. Medicare News, a nice big thick booklet. They send it out every year. It has everything you want to know about Medicare. It comes from the federal government. Online plan finders, those plans I was showing you, those can be found and compared online. State resources, you can check your eligibility with the state or with third-party carriers, for example, on financial assistance. Social Security Administration, SSA.gov, you can go online and you can check and find out. One thing I didn't mention, if you sign up for both these simultaneously, if you sign up for Medicare and Social Security, if you want, you can have that $148 premium, you can have it deducted from your Social Security benefit that you're going to receive. So that's an easy and clean way to do that. If you decide to take both, you need to consider that and determine when you're going to do Social Security, but 65 the first time you can is for Medicare. And then administration and elder care locator online. Similarly, you can find home health care as well. A lot of online resources to help you in that journey. It's all available. Now, having said that, I'm willing to help you. I'd like to help you. I'd like to make those resources available to you. I can look up your doctors and hospitals, make sure they take the plans you're considering. I can take your list of medications and show you the cost and show you the copays and the different at different pharmacies near you. Additional resources, I can help you find which gymnasium near you will accept that zero cost gym membership. I can help you check and see if you're eligible for both Medicaid and Medicare. As I mentioned, there's some feature-rich advantage plans for people who have both Medicaid and Medicare. And then finally, if you're a veteran and you've got VA or TRICARE, that kind of stuff, there's plans available that work. They play well with us. For example, they won't have drug coverage. You can continue to get your drugs from the VA, but you can get some benefits like maybe a dentist near you or something like that. So I can help with all that, and I'd like to. Having said that, there I am again. You got my contact information. I'm grateful that you stopped by today, and I'm glad to share this information with you. Please consider reaching out to me if I can be of any assistance to you. At this point, I'm done. Let me know if I can be of assistance. Otherwise, you have a good rest of your day. Thank you.